Now, I want to ask you if you've heard or you've paid attention to a certain virus that's killing people, spread to some other parts of the country. Well, it started in the Chinese city of Wuhan, and it spread to some 6 other countries now. It's a respiratory illness, and there's no cure for it now. It's really, really strange. There's a statement that was issued by the Health Ministry on this coronavirus infection. We're just going to go through, and my colleague, who is JoyNews editor Fred Smith, would join us with some details of it. So the health authorities in China confirmed an outbreak of a novel coronavirus infection on the 7th of January 2020 in Wuhan province in China, following a series of reported cases of pneumonia of unknown cause in December 2019. The outbreak was linked to a local animal market, but has also been found to spread from one person to the other. It can be spread when an infected person coughs or sneezes on another person, according to the statements from the Health Ministry. And the disease is characterized by fever, cough, and difficulties in breathing. So far, 4 people have been confirmed dead due to the disease. 3 other countries, Thailand, South Korea, and Japan, and United Arab Emirates, have also reported the cases. Well, there's an update even on this figure. So I'll just speak to Fred Smith, who's just joined me in the studio. Fred, good morning to you. Talk to us about this virus, which is not SARS. SARS, we know, came out in the 2000s, also killing, I think, about some 800 people globally. But this is not a global illness yet.
Yet, not yet. It's in the family of SARS, but not SARS. It is a respiratory disease, as we've been told, and the symptoms, you know, if you see someone with running nose, they struggle to breathe. Those are the symptoms. It doesn't mean the people have contracted it, but they are symptoms. So those people may need immediate help for us to know whether that's what they've contracted or not, so they can get some attention. So this started sometime last month in the central China city of Wuhan, and it started from a market, as you mentioned. In this market, they sell seafood, so there are fishes and stuff, all packed in the aquarium. You point and it's killed for you, that kind of thing. There's also a part of the market that was selling reptiles. So snakes, they're very common in China. They use them to prepare soups. So in very popular soups, they can have about 2, 3, or 4 different types of snakes used in preparing these soups. And I spoke to a professor, I recall. I went there about 1.5 years ago.
Yes. And
they told me that's very sweet. In fact, somebody even offered me that soup, just that I'm not used to it. Yeah, so
you didn't take snake, just so we clarify.
I did not.
Okay, great.
It is very popular in China, and so that is what the scientists in China believe started the whole thing. It started from that snake, and then it went on to humans. But the difficult part of this disease is that it spreads from human to human as well. So humans can pick it from animals and then spread it among humans, and that's what has been the difficulty. So far, the Chinese officials have confirmed 17 people dead, and more than 500 people have been infected so far within China. And we understand that 6 other countries have reported cases as well.
Which includes the U.S.
It includes the U.S., United Arab Emirates, Thailand, Japan, South Korea. So all of these countries have recorded cases, and the WHO late last night were in a meeting to consider if they should declare this as a disease of a public health emergency. What that would mean is for the global body, the UN body, to deploy resources globally to try and tackle this. There was no conclusion on this yet, because the officials thought that there was more evidence needed to arrive at that conclusion, such that will make that deployment happen.
So can you tell us what the ministry wants us citizens to know?
Well, they've given out a number of things. They're saying that you have to always wash your hands with soap, and this must be done under running water, just like we did in the case of Ebola. ensure that you are always washing your hands once you've touched strange objects. You've gone out, you touched people's rails, you've gone to shake hands with people and all the rest of it. Wash your hands and avoid touching your eyes, your nose and your mouth before your hands are washed. So once you've gone out, interacted with people and all that, try and wash your hands under running water before you do all of those things, touching your face and nose and your children and so on and so forth. Then you have to keep a distance. If you see people with the symptoms, and I'll give you the symptoms shortly, they are people with running nose, people with running
sometimes
nose,
they're also coughing.
People who are coughing, people who are having difficulty in breathing. All of these are signs, and that may not be a conclusion yet, but still take precaution. Do not get close to such people. Take a step back, for instance. The distance between us now is very safe.
Even though I'm not coughing, I don't have a runny nose.
Yeah, you don't have any of those. It's very safe, even if there's someone who has all of these. So that's what you need to do. But the health officials, the Ghana Health Service and other health officials in Ghana have currently mounted surveillance at the Kotoka International Airport and other entry points into Ghana to ensure that anybody who is suspected to have come from an area where this is coming from, mainly China, are treated. Yesterday, they spent the entire day trying to screen people who are coming in from China. Now, as we hear that the disease spread to other countries, focus is changing a bit. In a few minutes, the technical committee will begin a meeting to try and change the focus a bit, to expand the focus, to cover all of these new countries who are reporting cases. That's how the treatment will happen.
Okay.
But in China itself, where the thing started, Wuhan has been locked down. The entire city, city's public transport has been shut down. So if you are in, you cannot get out. If you're out, you cannot get in. So the health officials there will try and stabilize or control the problem before that can be released. Great.
Fred Smith, we'll try and get a lot more updates, particularly from this committee that's doing some work later on News Desk at 10. But thank you very much. That's my news editor, Fred Smith, with details of the statement issued by the Health Ministry. But if you've been following our conversation, in that statement, they say about 4 or 5 people have died. But if you look at the latest updates, as Fred gave it, 17 people have died and over 500 infected. So this is a serious illness which doesn't have a cure yet. So we'll get you some more updates and the precautions as well. Please take care of yourself, whatever you do. Make sure you wash your hands under running water. Take the necessary precautions if you're coughing, if you're having difficulties breathing. Kindly check in a health facility. Stay with us. We've got show business. Mapiro Sibidi comes up with some details in show business.